Good morning, everybody. I'm Dan Leary, the COO of We Speak Medicare. I'm also a certified macro healthcare professional. And the purpose of this Medicare Minute Facilitator training is to provide you with an additional tool for you out in the field. This Medicare Minute and becoming a facilitator is really a wonderful key to open doors. And it allows you to be in a non-confrontational, non-combatant from being an agent. And I know those words seem harsh, but sometimes when you go into a nonprofit, they look at us as a for-profit entity wanting to get to their folks. But what this is it takes us from being agents and elevates us to a facilitator who's going to provide pertinent information to the consumers out in the Medicare market. Now, Medicare Minute and the Medicare Rights Center out of New York, it is designed for all Medicare beneficiaries. It is not specifically for low income. It is not for the uber rich. It is for anybody that is within Medicare. So with that and no further ado, we're gonna launch this rocket ship and start going on. So here we are, we have the Medicare Minute, and the number one method to build trust with your prospects is to educate and inform them. You know, most folks don't want to be told what to do and told what plan they need to take. Obviously, that's steering, but when you have a good platform to educate them and inform them of their choices, the consumer makes their own decision, and the best thing is it sticks, and that is retention. And everything that we're going to do is based on retention with the end in mind. So with that, we're gonna look at prospects. Prospects look to experts for solutions and advice. They're hungry for resources they can rely on. They want to be well informed and given the opportunity to learn new things. And they want to pick your brain, because what they'll do, and what this new consumer generation is doing, the baby boomers, and I'm sure some of us on this call are baby boomers themselves, and what a baby boomer does and what their children do is they go to Google. They go to some kind of platform, they look up all the information, but the one thing that they all do and all want is they want to talk to an agent. They want to talk to someone that is a trusted advisor, and they'll pick your brain, they'll look for you for solutions, and they just want the information. This platform called Medicare Minute delivers such information. So as you're building trust, you're going to offer yourself as a resource to your prospects. You're going to freely share your knowledge, experience, and expertise, and you want to position yourself as a thought leader. And the reason you want to build this trust, right? And we all know that in sales, you want to underpromise and overdeliver. But with this resource is larger than the single consumer. This resource that you have, this tool that you'll be able to offer, is putting you in a position to open doors and get in to see numbers of folks rather than just one person at a time. So with that, how do we do it? And sometimes things segue in just perfectly. So we use the Medicare Minute. And that's provided by the Medicare Rights Center. And again, the Medicare Rights Center is based out of Manhattan, New York. They are a nonprofit, and they help seniors, anybody on Medicare. And some of the great things that they do, one that we had an experience with about 4 months ago, was there was a gentleman who was a veteran, 74 years old, never took his Part B. because of the way he was told when he got out of the service of how he was supposed to get his healthcare benefits, and strictly through the VA, he was misinformed. Medicare Rights Center was able to help him get the Part B premium fees, the penalties waived, and so he will be paying the normal Part B premium. And they did that through their legal activism and helped this gentleman at no charge. So this is going to really empower you once you learn and embrace this program. So we're in a partnership with the Medicare Rights Center. And the Medicare Minute are these short, engaging presentations on timely Medicare topics. And you can present them at local sites on a monthly basis. In order to be a Medicare Minute facilitator, you have to do two things. One, you have to attend this webinar to get the information. Two, you have to perform one Medicare Minute per month, and then there is a website that you go in and log what you did, because what the Medicare Rights Center, how they generate their income is from their benefactors. They show how many folks and lives they touch on an annual basis, and they get their revenue through that. So they created these great Medicare Minutes to increase their knowledge base to the consumers out in the market, so that in turn, as a nonprofit, they get more money. And they get that as a result of providing great service to our customers at no charge. So the Medicare Rights Mission and the Medicare Rights Center is a national nonprofit consumer service organization that works to ensure access to affordable health care for older adults and people with disabilities through counseling, advocacy, educational programs, and public policy initiatives. Well, big deal, Dan. Why do you want to partner with the Medicare Rights Center out of New York? It's really simple. They help write public policy for Health and Human Services and CMS. They train SHIP, SHIBA agents or facilitators across the United States, and Medicare Rights Center is well known, and I would encourage you all to go on their website later today and then sign up for their newsletter, select that you're a broker. It'll say no, then select that you're a producer, and then you will start getting Dear Marcy and one other thing delivered to your email box on a weekly basis. I highly recommend that, and being in the know, because it covers multiple topics that we'll go through in just a few moments. So in the Medicare Minute, it's kind of like a TED Talk. And if you're familiar with TED Talks, they are 20 to 40-minute presentations based on the educational ability and the I guess you would say, the attention span of adults. They found is 30 to 40 minutes of sitting down listening to something. Beyond that, it better be a comedy or some kind of sitcom. But on that, these topics are very relevant. And some of the recent topics have included the Medicare enrollment periods, appealing denials of coverage, preventative care, coordinating Medicare with other types of insurance, how to read the EOBs, that's the explanation of benefits, and the MSNs, the Medicare summary notices, and the programs that help pay for Medicare costs. And so what we have here is a platform that crosses a wide spectrum of information that folks are thirsty for, and they want to drink in this information. So as you can see from the small print there, I don't have glasses on, I can't read that, but I do know what's on there. So this is a topic archive, and you can pick your own topics. There is a plethora of topics that come out that are housed in the archive system, and then there's new ones that come out every month so that you have fresh topics. And the great thing about being a facilitator is you're able to bring content. Now, write that down, content, and write this word down, relevant. Because what you'll provide is relevant content that's going to be relevant to the consumer, and it will make you relevant to them. So what you're doing is you're putting yourself in as a subject matter, not expert, but as a subject matter facilitator. In Medicare, we never want to call ourselves experts because you cannot use superlatives, as you all know. So as becoming a facilitator and being able to have a plethora of topics to go over, you can find sweet spots that you're comfortable with. I know there's some folks that I know in certain parts that they themselves are diabetic, and they like to talk on topics of diabetes because they live it every day. But these enable you to have topics of discussion to put you in as a trusted advisor. And we will have more on this as we go through the slides. So support documents include 3-point scripting, set of teaching materials, you get audience handouts. And the great thing is once you go through this entire presentation and we get you signed up, you'll get access to these, all of these materials. And as you can see there to the bottom left, they're fully customizable to your agency or you. And what that does is it creates a wide partnership for We Speak Medicare, the Medicare Rights Center, and you as an agent or as an agency owner. And you can co-brand on there your name and number, all on that. There's a section on that, and it makes it editable. You can't edit the text, but you can edit your name on the information. And I think that's really cool to be able to have even an additional business card that states Medicare Rights Facilitator. And they have the things like that you can use on their website. So with that, why? Again, we want to always question why. What's the benefit? Why? Well, we want to establish yourself. You are a brand. Your agency is a brand. We Speak Medicare is a brand. And so as establishing yourself, you're establishing yourself that you are an educator for the community on different Medicare topics. Again, it enhances your brand. And what it does is it puts a positive spin on your reputation amongst community influencers. Community influencers are important because as an agent, you're going to need key alliances. We have key alliances and we've been making inroads into key alliances. What are key alliances? Well, we have a really strong key alliance through John James and Homage. And that alliance allows us to talk to folks there and to present information. We have also established relationships with some medical groups. We have established with some radio stations. And so we're going to community influencers who are basically gatekeepers who look at us as an individual who's not coming in to sell insurance, but to provide great quality information that's timely, that helps the people they help. All we ever want to do is create W's, wins, all around for the consumer, for the key alliance that we're working with, and then back for yourself and us. Now, I see that it says, hello, my name is Expert. I have trouble with that because 7 years at United Healthcare as a sales director, I know compliance extremely well, and I would never put the word expert on anything near Medicare at all. Please don't. So you need to differentiate yourself, and that's what this is about. By using the nonprofit edge to get past the gatekeepers, it's going to allow you to have a different strength in the community that you're just not an agent, that you are a facilitator that brings quality information and actually helps the consumers with them in mind. And all of these organizations will know, and you can tell them that you are an agent, and I do myself, because I believe in transparency. And I spin it like this. And I know it says right there something, but I don't really like this comment. But what I think what you can do is use this topic to get in to the folks by bringing them information that's important to them. And as you can see in this slide, it says, "Hi, I'm Valentina, and I help seniors find and purchase Medicare health plans. I'd like to do a presentation to your customers to help grow my business. When can we get that scheduled?" Well, as you can imagine, this is a negative slide that's been put in there to kind of make you, and I'm looking at Susan and she's like, "That's not what you're saying." This is what gets you out. This statement here, the "Hi, I'm Valentina, and purchase Medicare plans," is telling that nonprofit, that key alliance, that all you want is their access to their people so you can make money. Now, obviously, this isn't how you want to present yourself. This is a better way to present yourself. "Hi, I'm Valentina, and I'm a Medicare Minute facilitator for the Medicare Rights Center. They're a nonprofit organization that helps older adults understand and access high-quality healthcare through advocacy and education. Would you be interested in hosting a Medicare Minute event for your customers?" And I think this, and I know I use something similar to this, but I always bring it through advocacy, education, and hosting a Medicare Minute. And you're a facilitator for the Medicare Rights Center, because once you pass through this training and you sign up, you become a facilitator. That gives you strength. You now you've created a difference between you and an agent who doesn't have this ability. And if it's you versus this other agent, I would say, I'm never going to say 100% of the time, but I would say 75% of the time, you're going to have greater access and greater success through your advocacy and education utilizing the Medicare Minute. So you want to differentiate yourself and become a resource for the facility or the organization. I always think that as you want to do that, what I would suggest is, as you're sitting there talking to someone and you're getting this key alliance gatekeeper, and you're sitting there talking to them about what you would like to present, you have these materials that are on the screen right now. And as you can see there, this is a brilliant idea. Schedule a year's worth of events in one meeting. Know before you go. You want to make sure that your calendar is full of activities that put you in front of prospects on a weekly basis. If you do at, let's say, one Medicare, let's say a nonprofit somewhere, let's say a senior center, and you're there once a month presenting material. Well, that's only one activity a month. How many more senior centers, how many more entities, nonprofits, provider groups, hospitals, local newspapers would like to have content and like to have information that's pre-made and topics that eliminate the need to create your own? And you're able to present things that have been fully vetted by the Medicare Rights Center and approved content by Medicare. So you are coming in as someone who's fully vetted and has information. And that's why we schedule a year's worth of events in one meeting. All you're talking about when you say year's worth of events, it's only 12 meetings. You might want to do 2 in the month of October, especially during the first 2 weeks of October. Now, as you can see here, you want to promote yourself. You have the ability to utilize these tools once you become an authorized facilitator. And becoming an authorized facilitator then opens the door for you to use these tools so that you can knock on doors. Now, in order to do all of this, you're going to have to, on a monthly basis, you're going to have to let us know, and you go on there's a website and you just register yourself. We'll send you all that information once you get through these classes, and then you will always go in and put your presentations in there. You do the presentation, you log in and say, I presented at this facility, I did this topic, and there were this many folks. And that's it. That is your commitment, is to keep track of the number of meetings you're doing. The other one is to prevent everyone on this call from stepping on each other's toes. We're requesting that if you have a medical group, a nonprofit, or somebody that you're actively knocking on the door now, send us through email the name of the facility, the name of the individual, phone number, email, and we're building a spreadsheet. We have a spreadsheet that we'll be able to say, Susan is working with the Everett Clinic and she's got these set up. So we don't want the agents to step on each other's toes, because what we want you to do is to own the program. If somebody else is already in there and they're a We Speak Medicare agent, they're part of your team, some other team, we don't want to cut anybody's throat. There is so much business here, and we are the premier agency that has the ability in the Northwest to promote this. So it is very exclusive to be able to have this opportunity. And again, these are more ways to promote yourself. Now, you want to always reward yourself, and relationships with facilities and organizations create additional opportunities during the year, right? So this is, for all intents and purposes, building a pipeline of prospects. And they become your prospects, and it's much more advantageous to build a pipeline of leads and prospects through activities like this, or a health fair, or an event like that, than trying to buy turning 65 leads, trying to do this, that, or the other, and trying to buy things out in the blue sky that everybody else is buying. Like T65 lists, if you buy 3 zip codes in Washington, in King County, I guarantee you 100 other agents have those same lists. So this is another differentiator. You become an AEP resource center. You can become an LIS screener. You go to sponsored events and outings. The possibilities are endless. And I really like the graphic at the bottom. There should be one more graphic. It should be one where the person is you, or me, or Susan, who's actually putting the seed in the ground. Because putting the seed in the ground is your first door knock. It's your first reach out into the community as a facilitator. Now, the thing that you always want to do is make sure that your plants are growing and you're getting the information out in a quality setting. And secondarily, no one will ever come down on you for helping the consumers. All they ever want in these nonprofits, they don't care if you make money. They just want to make sure their constituents are taken care of. And if you do no harm and all you're trying to do is present information, no one will worry about the amount of money you're making, because the money is really, if you look at a scoreboard, your money is how well you're treating clients. And the more clients you can treat well, the more clients you can see, well, conversely, the more money you'll make. The bottom line is, by doing things like this, you need to think of with retention in your front of your mind. This helps build that retention because you're building trust and you're setting yourself apart from Joe agent down the street. Again, this is year-round sales opportunities. I can, with full conviction, sit here and say that when you look at the West Coast, from the border of the bottom of California to the top of the border of Washington, when you look at the consumer, when you look at the senior, 1 in 3 Medicare beneficiaries live at or below the federal poverty level. That is horrible. And we need to go out and help those people. And the more people we can help, the more people we can empower, you're going to make more money. And no one's going to ever care about that. CMS, Medicare Rights Center, and the folks you're helping, they want to make sure that you get into these things because they want the help. So with that, we'd like to open up the phone lines or open up chat and questions. So that if you have something in particular you want to ask, please do so. So raise your hand if you have a question and we'll click on you so we can unmute you. Wow, did I do that good of a presentation? You don't have any questions? Is it going over there?
Okay, here we go. Hold on. Let's let Tony talk first. Tony Enfield. Tony.
Hi, Tony.
Hi, Dan.
You're on
Can
the
you hear
air.
me? I hope I'm not on the air. Can you hear me?
We can hear you.
Great. I've already done the Medicare Minute training and done one of the Medicare Minutes presentations at one of the shags up here in Seattle, and it was very well received.
And so and thank you for sharing that. And by the way, this was not a paid endorsement. So, you know, if you don't mind, maybe from an esoteric view, what'd you think? Be honest. I mean, I know you had good reception, but how did it play out for you?
It played out pretty well. You know, you have to study the material and practice in order to be able to give a coherent and a reasonable presentation. They encourage you to basically have a round table and to share and let your participants share in the presentation and in the meeting, and that happened and it came off quite well. I had the schedule for the rest of the year's meetings, or not the schedule for the rest of the year's topics. Mm-hmm. And at the end of the presentation, everybody took a schedule and brought it home with them. So they were obviously interested in further topics.
So have you received any leads off of that yet?
Well, 3 of the people in the meeting said, we need to talk with you a little bit later in the year about this. So yes. And
so I would think at that time, then that creates a permission to call. It would be good to use a scope of appointment, or not a scope of appointment, but a call slip of some kind. So that way you have it on record, and you know to you can call them back in, I guess, maybe September, October, when it's probably when they want to it during AEP, right?
Yeah, I'm usually at this particular shag several times a year. I'm going to a wellness fair there tomorrow. And so I'm sort of I'm a familiar face to them.
That's excellent. And what happens is that now you are becoming a subject matter advisor, and you become trusted, and you're going to have more people that will say, hey, can you help us with our plans?
That's the plan.
All right. All right. Well, great. Thank you. Thank you. We're going to go to, who are we going to next?
Gary Flooring wants to know, can we have Medicare rights printed onto our We Speak Medicare business cards, or do they have to be separate cards?
It should be a separate card, right? So you're a facilitator, and you're not hiding the fact that you're an insurance agent, but you want to utilize the Medicare facilitator. At the same time, I will verify with compliance, but I think it's a compliance issue, but I will verify that. So if you don't mind, Gary, if you can email me that same question, Dan Leary, Leary at WeSpeakMedicare.org, and I will find out this evening. I'll go right to our compliance department. All right, what else do we have?
From Sandra, please review the login information for the contact to Medicare Minute.
I'm not sure.
Sandra, I'm going to go to you and let you speak so you can ask the question. So Sandra, you now have the microphone.
Hi, Sandra.
Oh, she just left. No, there she is. Allow to talk. There you go, Sandra. Oh, yes, you're on. Sandra? Okay, Sandra, if you can, it says you're allowed to talk, but we don't hear you. So what we're going to do, are we going to have a follow-up to today, Dan, like what the next step is for everybody with Medicare Minute? And
yes, so everybody should, you heard my email. Again, it's Dan Leary, Leary at WeSpeakMedicare.org. Please email me and Susan any other questions you have. We're not hanging up at this time, but if there's anything specific that you'd want us to reach out to you, if you think you have something ready to go, because Susan and I are really good at landing these key alliances as well, and don't mind helping you with that. And as a matter of fact, that's what we do. So please reach out. So Sandra, if you're,
yeah. So
let's see, who else has got a question?
we've got Jean Christensen.
All right.
It doesn't look like it's, can you hear us, Jean? Can you talk? Jean Christensen? Jean, I think we hear you. Jean Christensen? Jean, you're allowed to talk now. If you would like to speak, your hand was raised.
I'm talking. Can you hear me?
Now we can hear you.
Now
yes,
we hear you.
Now we hear you.
Okay, I have a question. I would like to use this as keeping in touch with my clients during the year, sending out key information.
That's awesome.
Okay, so do I report that to Medicare Minute?
So, there's I think that what they're looking at is touch points, right? And so, yes, you can do things for your clients. You can either do a webinar directly for your clients. You can send them the pieces for your clients. It's touch points. That's what they're looking for, and how many times you've either facilitated and or sent information. Does that help?
So then log it in and do.
Yes, always log it in.
Okay, good to know.
Thank
Thank you.
you.
Very much.
And Patrice wants to know, how long is a typical presentation?
Well, a typical presentation is 20 to 40 minutes. Sometimes they go a little bit longer, but they're 20 to 40 minutes.
Okay.
And how do I get certified? Well, you get certified partly by your attending this webinar, and then you're going to send emails to myself and Susan. So one email, CC either me or CC Susan. And then what we're going to do is we're going to take all that information. We're going to send it in to the Medicare Rights Center, that these are all the folks that attended the presentation. Then you will get listed in the system. Usually takes about probably less than a week. And once you're in there, then you'll have the access to go into the website, to click on, to pull your materials, and to do all that. So by attending this and sending the emails is getting you certified.
good. So there's that second step. Attending was step 1. Step 2 is the email. And that way we know that you've not only attended, but you are interested in this. So we'll go ahead and get you signed up.
That's right, because that's the real ticket to entry is your email back to me after you've attended this. All right, do we have any other hands?
Any other questions? It looks like all the questions seem to be answered there. Oh, by the way, there are questions under Q&A, and for some reason, we can't access Q&A, and I have not run into this problem before, so I'm not sure where the Q&A might be. So if you have a question, sorry about that, but if you have a question that's in Q&A, if you could please raise your hand or do the chat instead. The chat's working, but the Q&A is not. So go ahead, if you've got a question that hasn't been answered yet and you put it in Q&A, go ahead and raise your hand and you can ask it or you can chat it to us. Okay, good, here we go. From Carmen, where do we place business card orders for Medicare rights?
Well, all that will occur once you send the emails, and you'll get a whole listing of what you do, what the next steps are. So first thing you're doing is attending this webinar. The second thing you're doing is sending out the emails, and we will respond in kind as to the next steps for you.
And I'm typing my email address right now because someone just asked that. Okay. So does everyone see my email address, susanhorst@wespeakmedicare.org? Hopefully you do. So go ahead and just email me. You could do it right now if you want.
That's right. That's right.
Okay, so then we're backing up. We're getting more questions here. Yeah, we did that. Jay Paulson asks, can we use the logo on our personal websites?
There is the ability to do that. Again, once you go through send us the information and you commit, because you have to commit to performing as a Medicare facilitator, you have to do 1 presentation a month. If you don't do the presentation, then Medicare Rights Center terms you for not doing them. So if you're going to put something on a website, we'll first see if compliance allows that. I think it is, because you can have a business card. And they probably want you to link it. But you want to make sure that you are compliant in how you put that in there. All right?
Typing it in again, my email address. Because I noticed it wasn't going to everybody. And now, okay, so now all attendees should have it as well. SusanHorst@wespeakmedicare.org. Thank you for those who let me know that you couldn't see it. All right, looking for other questions. Okay, this is from Sharon Nair. I sat on the Medicare Minute training with JSA just under 2 weeks ago. They have their own reporting for meetings held on the agent portal. Is this the same or different if I am going through both trainings?
It's the same portal. It's the same portal. Where you log the information is on the JSA portal. And I'm glad that you've gone through the presentation twice. And the great thing is, by going through the presentation with Me Speak Medicare, is this is your local team that's on the ground that has invested quite heavily into the Medicare Rights Program and the Medicare Minute. And we are the largest force of agents up here that are able to do this. So JSA offers the platform, and since we are a partner of theirs, we are taking full advantage of this platform.
And you would like Dan's email? Hold on just a minute. And just to get everybody used to it, don't forget, wespeakmedicare.org is our website. And if you go to wespeakmedicare.org/forms, FORMS, and I'll type that in here. You'll see that there is a listing of staff names, photos, what we do, and email addresses. And now I'm going, so go ahead, wespeakmedicare.org/forms to find the our staff information, and then Dan Leary at wespeakmedicare.org. So now you've got Dan. So now you have Dan, you know where to get the information on the forms page. And we'll probably be uploading, we will be uploading this video that we did, this webinar will be uploaded to the forms page shortly after today. And Sandra wants to know about getting her picture on the website, wespeakmedicare.org. Great. We want all of our brokers to get their faces on our website under our list of brokers. So please email Serena. And again, Serena would be on that staff page, but I'm going to put her email address up here. It's a little different. She is admin at wespeakinsurance.org. So Serena is admin at wespeakinsurance.org, and she can get you get your bio and your photo up on wespeakmedicare.org.
All right, any other questions on the Medicare Minute? Here's a question. Does anyone feel, besides the folks that are doing this, how many of you are really interested through a raising of hands in really promoting this program in an effort to write more business? I'm watching for hands.
Yep. Oh, looks good.
It's all about writing more business, everyone. We only make money when we write applications. And so I want to leave you with one of these parting thoughts. Every day that you're out there in the market, ask yourself, am I doing something today that's going to help me write more business? Because remember, you're really building a legacy for yourself. The renewals on this with lifetime renewals is the fantastic thing that we have in our industry. This is a tool that helps you. I can see that not all hands are raised, and I don't ever expect 100% folks wanting to go into programs, but I can tell you that the key to entry in this is attending this webinar and sending the email to myself and Susan so that we can get you registered. And your commitment on your end is one facilitator meeting per month. And again, if you go to one place and you book it for the whole year in advance, like has been done in an example from one of your peers, this is your commitment. We will track where when you're doing this. We'll also make sure by you sending us in what areas or what teams or what providers, key alliances, nonprofits, and we will have all of that housed on our systems so that we make sure no one's stepping on anyone's toes. You actually have to be actively working that place. If you are just listing names and you haven't gone and you're not actually actively trying to become a facilitator in that location, then that's really gaming the system. We only want folks that are really going to be legitimate in doing this.
Okay, and Tony has one last question. How much of a problem would it be for all of us looking to do a bunch of these at the same institutions? We kind of talked about that, but maybe go into that a little bit more to.
Well, that's what I'm talking about. So if someone is in, let's say like earlier, who was it?
Like she went into the SHAG.
The SHAG.
Yeah.
Yeah, right. So Tony is in SHAG.
One of them.
In one of them. So that would be, you let us know which one you're in. We'll put that in the spreadsheet and we'll make sure that other agents aren't dumping into that, because we don't want to dilute the pool. We want to make sure that everybody has their working agendas and that are following the Medicare Minute and they have their key alliances set. I think it's really horrible when agents don't respect when they see somebody else has got their plaque in there or they have a stand up and it says, Susan Horst, We Speak Medicare, and you're also with We Speak Medicare, and you're trying to displace another We Speak Medicare agent. Not cool at all.
Yeah. And so this is how we can work as a team, and the benefit of being with We Speak Medicare is that we will keep track of that. so that we have that spreadsheet. And so you just need to let us know, like Tony, let us know which shags you've been in and are already working to get those Medicare minutes into. There are lots of shags in the Puget Sound. There are thousands of community contacts, and we want to get every one of those covered rather than having everybody at once. So and Sharon's saying, how quickly will the spreadsheet be sent out? I would say based on how quickly.
We're not sending a spreadsheet out. You're going to send us what you want to do. We're not going to send out everybody else's what they're doing. We want to know what you're doing, and we'll house it, and we will let you know if there's somebody else in that particular facility already. We have to be transparent with you, and we want to be, because this program weighs a lot. It means a lot to Medicare and you as an agent. So the last thing we want to do is dilute the program and have everybody stepping on each other's toes. We will look so unprofessional in that, it wouldn't be beneficial. Any other questions? Comments? Snide remarks? I take them all.
All right, great. Thank you, everybody.
Yep, I think we can go.
Yep.
I think everybody's got great information. I know you all have more questions, but just send us the emails. We'll respond back to you. You have my phone number. You can text me. You have Susan's. We're here for you, and we want to make sure that this program stays very sterile, is transparent, and by doing that, we work as a team. We can corner the 4 from top to bottom of the Sound, from west to east. In the state of Washington, we are the premier organization with the Medicare Rights Center.
Thank you so much, Dan. Appreciate your time today. And thanks
Pleasure.
everybody
Bye, everybody.
being on. Bye-bye.
So we need a list of everybody